This is going to be intubation of a pediatric patient. For whatever reason, we need a definitive airway. Maybe blow-by isn't working or BVM. We need a more advanced airway. So what I'm going to do, I'm going to get capnography and a BVM first, doing pre-oxygenation and having my patients be brought up by either towels or some other adjunct. So we're going to have good lung compliance, 1 to 2 second intervals between the breaths, which is 30 to 60 breaths per minute. While my EMT partner does this, I'm going to get my equipment out. So first what we're going to do is I'm going to get my tube taper. I'm going to get the correct size laryngoscope that I need. I'm going to get the ET tube that I need, plus a stylet and a syringe. I'm going to make sure that it works. It does inflate all the way with the pilot balloon, so I'm going to take that out. I know that the correct ET tube is because this would be maybe a 3-year-old patient, so age over 4 plus 2, or a plus 3, depending on if it's a cuffed, and plus 4 if it's not. I'm gonna get the correct lubricant that I need, and we're gonna get suction to the side. Making sure that the patient is pre-oxygenated for 3 to 5 minutes. We're going to start our intubation attempt. So I'm going to have my EMT partner hold this to the side while I look inside here. If you can come to the side real quick. I'm going to be looking in, going down the tongue, looking for the epiglottis, and making sure that I see the auricula, holding open that epiglottis. I'm going to have my EMT partner hand me this while keeping visual. We'd have this lubricated by then. Going in, see it go past the vocal cords, come out. I'm going to inflate and immediately take off. There we go. Take this out. I'm going to have my EMT partner give me my BVM without the mask on it. And then we're going to get confirmation after doing that. We see that the chest is rising and falling. We're seeing that capnography is up. And we're also going to listen for lung sounds and listen for if there are epigastric sounds. If so, then we're going to extubate and continue BVMing. I'm going to have my partner, after keeping my hand on here, start the tube taper. So keeping this in place, getting this out of the way. I'm going to put this in here. There we go, putting that in his mouth and keeping it down. Making sure we listen for lung sounds again, just in case the tube taper has moved the tube out of place, either too far in with the right main stem or taking it out and we hear epigastric sounds. But now we're going to monitor and make sure that we have the T-tube in throughout the transport and task complete.